Hi, my name's Jess. I'm the mother of a 6-year-old. His birth was one of the most precious and life-changing moments in my life. After his birth, my son received his newborn hearing screening test in hospital. Having a newborn child can be exciting, but also a little bit overwhelming in the first few days. This video is about sharing information with you so that you know what to expect when your child has a hearing screen. All babies in Australia have access to free newborn hearing screening so that we can pick up any ear-related issues as soon after birth as possible. Most importantly, we need to identify babies at birth so that babies who need additional help, such as hearing aids or cochlear implants, can receive them. Hearing loss is invisible, and that's why we screen. Around half of all hearing losses have no risk factors that the family can identify. Without screening, we may not pick up these issues for several years. When your baby is born, he or she will be screened for a range of conditions. This graph shows the most common ones identified. It may come as a surprise for you to see that hearing loss is by far the most frequently identified condition in newborns. Our screening allows hearing loss to be easily picked up quickly and painlessly. Early detection and early intervention offer the best chance for babies to develop listening, speaking and social skills. Newborn hearing screening is a simple process that's done while your baby is asleep. It's a baby-led process that can take anything from 2 minutes to 10 minutes to complete. First, sensors are placed on your baby's skin on the forehead, neck and shoulder. Then small earphones are placed over your baby's ears. Soft clicking sounds are then played through the earphones, and your baby's responses will be collected by the 3 sensors. The results are available as soon as the test is complete, so you'll be given the results immediately. Sometimes further tests are required. If this is the case, then the screener will explain the next steps to you. Some families think they can self-test a baby's hearing at home, or that they will just know if their child's hearing isn't normal. What we must remember is that babies have very subtle responses to sound, and reactions such as being startled by slamming doors or loud noises doesn't always mean your baby can hear properly. Hearing loss isn't all or nothing. We need to make sure your baby can hear all the softer sounds of speech. Hearing loss is invisible, but easily identified with a simple screening test. If your baby doesn't pass both screens in hospital, then a referral to an audiologist for a more detailed assessment will be necessary. This assessment is called a diagnostic assessment and takes place within a few weeks of birth. The appointment takes place at our Northbridge clinic, where baby will see a specialised paediatric audiologist. The test can take between 1 and 3 hours as baby needs to sleep during testing. The equipment will measure your baby's response to sound, and the audiologist will determine the level of your baby's hearing. The results will show each part of the ear and how much baby is hearing. The audiologist will discuss the test results with you once the test is complete. If your baby does have a hearing loss, then there are steps to take to give them every opportunity to develop speech and language just like everyone else. Children with hearing loss can have difficulty learning to talk. From birth to 3 years is the most important time for your baby's brain development, as this is the time speech develops. And you can't learn to speak unless you can hear even the very soft sounds. Here Today Clinic is a specialist clinic for children, providing the full range of best practice hearing tests from newborn to adulthood. We provide a range of hearing tests using comprehensive state-of-the-art diagnostic equipment for all children, including babies. These can be done with or without a referral from your GP. We also provide a monitoring service for children with hearing loss risk factors or those with ongoing middle ear issues. There are a number of assessments we use to assess your child's hearing, so our experienced paediatric audiologists will adapt the hearing test to your child's development and needs and make sure that your child has a positive experience in a new environment. The tests can include checking the middle and inner ear and using child-friendly activities to accurately assess the levels of hearing in your child. Our focus is always on getting best results without distressing children. Those who are timid or overwhelmed in new situations may need a second visit to get a completed test. Most of these assessments take around an hour to complete, but this will depend on how your child is feeling on the day. The audiologist will discuss all the outcomes and options with you, so the process and next steps are clear and easy to understand. If you have any concerns about your child's speech or hearing, then a simple test can give you the answers you need and give your child the best start in life.